Hi everyone, I'm Dr. Neena, maternal fetal medicine specialist. In this video, we'll share some tips and tricks about the exercise in pregnancy. It is a very common concern among the pregnant women whether they can exercise during pregnancy, especially if they are very active pre pregnancy, very much into running, swimming, or any aerobic exercises or any type of exercises. Is it advisable to continue those exercises during pregnancy? Yes, surely those exercises can be continued in pregnancy as long as she is comfortable to do that in pregnancy at any point of pregnancy, and also it is safe. So, those who have been doing exercises even before pregnancy, we can continue during pregnancy, as I've mentioned, as long as it is safe. What does the safe exercises means? So that there is no risk of falling and having an injury which can harm you as well as your baby. The exercises like moderate running and swimming, yoga, which is not hot yoga. So these exercises, the brisk walking, all these exercises considered to be safe in pregnancy. While the exercises like hot yoga, off-road cycling, and scuba diving, skating, horse riding. So these exercises, which is more strenuous exercises, as well as there is a risk of falling and then having an injury, are better to be avoided during pregnancy. And if you are starting a pregnancy newly, if you are starting an exercises newly in pregnancy, better not to start with an aerobic exercises straight away with a lot of time. So you can slowly start if you want. Start with 5 minutes a day, and then slowly you can add on 5 more minutes, and the maximum. There is no actually maximum recommended time limit for exercise in pregnancy, but the usual recommendation is to keep as active as much as possible so that you'll remain healthy during pregnancy, delivery, as well as after birth. So, recommended time period would be at least 30 minutes daily. If you are not comfortable in doing 30 minutes daily, it is okay. Just do 5 minutes or 10 minutes. And you can, if you find it difficult to walk and run and do a lot of movement, just at least you can try with the upper limb exercise, the hands exercises like juggling of the waters, or just do some sitting exercises. And that too, if you do the exercises and be active almost all the days of the week, that is at least for 5 days of the week, that would be great. Why to do these exercises? It is always important, not only in pregnancy, even otherwise, to keep ourselves active so that we will be healthy. So it reflects on the pregnancy health as well as for your baby also. It prevents the undue weight gain during pregnancy. It reduces complications like having diabetes in pregnancy, high blood pressure, and of course it will not increase the risk of miscarriage or early delivery, preterm birth, or having a bleeding in pregnancy, or having a early break of the bag of the membranes. So those are all myths. So as far as you are doing a safe pregnant exercise in pregnancy, it is very much recommended for a healthy pregnancy outcome. Now, during pregnancy, it is always advisable that you must feel comfortable. Don't try to make the pregnancy so much strenuous to the point that you feel so much tired. The dictum is that when you do an exercise, you should feel as much comfortable to talk to another person. So don't overdo or don't try to do any strenuous exercises, and always get hydrated very much, especially during the first trimester when you are suffering from nausea, vomiting, and your other sickness. And also try to wear loose clothes, comfortable shoes, and it's not mandatory. If you feel comfortable, you can try to do some sort of exercise. The main point is try to be as healthy as possible. Just because you are pregnant, it doesn't mean that you have to be on bed the whole day, the whole night. You should not move out of your room, and you should not do your daily activities. Another important thing is when you do the exercises, if you feel increased sweating, palpitation, that is uh, fast beating of your heart, shortness of the breath, and chest pain, or any uncomfortable feeling, just stop the exercises and then try to do even lesser strenuous exercises. So, otherwise, continue the exercises even after birth, also, which helps to have you to have a healthy lifestyle. Thank you.